Hey, Emilie, so glad you're here. I can't wait to jump into the conversation. And before we do, I already read your bio, but I want to make sure that the folks who are listening in have a little bit of context about what kind of writer you are and what you do. So let us know, as a health content writer, a medical writer, what kind of writing do you do, and what kind of companies do you enjoy working with the most?
Perfect. Well, thank you for having me, Megan. I'm excited to be here. So I do a lot of health content writing. I write for a lot of companies that focus on, health content for the general public. So like GoodRx or Paloma Health. I have also done some business to business writing. So I had one company that I did that for, which is very different from health content writing, but it was a nice kind of shift. And now I've just started to dip my toes into like drug information type writing.
That's very exciting. Can't wait to hear more about your journey. So, on the health content writing side of things, what was it that inspired you to look into or pursue health content writing to begin with? I will caveat this by saying Emilie was a part of my fourth Health Professionals to Health Writers cohort, which was May 2022. So I'm asking her to think like a long time ago, like several years ago. So sorry, Emilie, if I'm making you like pull out cobwebs. But I'm curious as to what sparked your interest in health content writing.
Sure. So when I found health professionals, the health writers program, I was on a career break. I had worked in hospital for over, it was probably about 13 years in hospital pharmacy. And during those 13 years, there was so much, I spent a lot of time talking to patients. We used to do medication reconciliation at the bedside. And just when you would go over those medications with them, that you realize there are these big gaps. And in those big gaps, they were filled in by, the internet searches, things I read on the internet, things that you're like, oh, I'm not quite sure that that's quite right. Or are you sure you should be taking all these together? And so it kind of just raises awareness. There is a huge need out there for reliable, accurate information for anyone really about the medications and supplements too. There's tons of supplements out there that interact as well, as we probably all know. So just kind of filling those gaps really kind of made me go into medical writing. I even know in my own personal life, my mom would send me some stuff and I'd be like, where is this from? What are we talking about? Can we go back a little here? So I kind of was like, you know what? I think this is a really huge need. And I really liked educating patients. So this is kind of education, just on a much broader span.
Yeah, I like that perspective. Education in a broader span, on a wider scale, and then probably in a different format than you were used to educating. Because as a pharmacist, I'm imagining that a lot of that education was verbal and interactive, whereas in writing, of course, that's a more written style. Did you have any doubts about your ability to translate that education to a written format? That is what I hear from a lot of pharmacists and other healthcare professionals who are interested or intrigued by health content writing. And they're like, I love patient education, but I don't write. So am I qualified to educate patients in that way? Did you deal with any of that self-doubt, or how did that show up for you?
Oh, absolutely. It was definitely because I never pictured myself as a writer. I guess maybe probably a lot of people, you just don't picture yourself as a writer. But I just kind of when I write articles, I think okay, I'm talking to a patient. How would I talk to them, or how would I explain this to them? So having had all those bedside conversations before, you can kind of anticipate what they're going to ask. You can kind of be like, okay, I didn't cover this quite well. Maybe I need to go back and rephrase that. So I think just having that experience helps me. And then through the course of it, learning how to write, it just kind of comes, comes at times. And with your editors, they're kind of like, oh, you maybe do this a little differently, do this, better next time. And so, yes, I had self-doubt in the beginning. I think now I feel a lot more confident doing it.
Awesome. So have a great understanding of what it was that inspired you to pursue health content writing. As you were considering how to get into it or how to get started, of course, you somehow came across health professionals, health writers. And so what was it about the accelerator that prompted you to join that program as the way to make your way into health content writing?
So on my career break, I started listening to a lot of podcasts. And one I came across was the Pharmacist Voice, and she had done a whole series on women in medical writing. And so I listened to the whole series, and I had been toying with medical writing before that. I guess I should back up. I was toying with medical writing before that. And I was actually thinking about like, maybe I need to go back to school. Like, should I go to, like do a certification program? Like maybe I need a different degree, like a master's in, I don't know, journalism. Like, I don't know, so like, but then I was like, I don't really want to commit to like another college degree. Like that was kind of like, And so like, after listening to the series on the Pharmacist Voice podcast, I was like, well, and I was really inspired by your talk with her, because I was just like, I don't really need a degree. I just need to take my skills that I use I gained in pharmacy school and just use it differently. And so when I saw that cohort was opening, I was like, this is it. I have to do it. Just gonna like jump in. I'm going to do it. So that's kind of what inspired me to do it.
Awesome. And I'm so glad you did. You are a great student. And what you said in your previous response about the fact that you did have some doubt, but you kind of approached it as, how would I explain this to a patient? If I were just speaking to someone, what would I say? Let me put that down on paper and then use that as the basis. I think that's where a lot of people get like tripped up, because there's this perception that like, oh, if you're a writer, you have to speak a certain way and you have to use these certain words that you wouldn't normally use. And I personally think the best writing comes from writing the way that you speak, especially when you're, considering your audience and things like that. So I really enjoyed having you in the program, because like as soon as I saw your first blog post come through, I was like, oh yeah, she's going to be great. She's got this. But were there any concerns or worries you had before you actually started the program? Like sometimes you're like really excited and then you make the decision, you make the purchase, and then you're like, ooh, well, what about this and what about that? So like what one or two concerns did you have before you actually started?
I think definitely the business side. It's not you have to go find your clients, and I'm not in sales. But I will say the way like you taught us and like the way to approach it and reframe your thinking about it has helped a lot. So like that definitely like, okay, like how do you find people? Like I'm used to, you submit an application, you get a call from HR. Like this is totally different. So that was definitely a concern. And then of course there's always the concern like, well, what if I fail? Like what if I just it doesn't work out? Like, then what do I do? And so I think those are kind of like my big ones going into it. But I also knew that I also know myself, and I was like, you know what, it's going to work. Like, I'm going to, we'll see how it goes. And it's a learning process. And from here, it just kind of opened a lot of doors for me.
I know there's a point in the program where it might be like phase 3 or phase 4. I don't know. It's where things start getting real icky,
Yep.
For lack of a better word. And I talk about how like you need to have a plan, you need to have a strategy, but you also need to have tenacity, you need to have perseverance, because things will not always be easy. Like it's not easy to be a freelance health content writer, because as a freelancer, you are a business owner. And so you have to expect that things are not always going to go your way. People are not going to always respond to your outreach. You're not always going to get the gig. And so in those moments of, I guess, hardship or adversity, whether during the program or in your experience after the program, as you continued on your journey, how have you remained inspired and motivated? That's another of the things that I admire about you, is that you kept going even when things got uncomfortable. So how did you manage to do that?
I think a lot of it, let's see. Gosh, I know like recently things did slow down a lot in the freelance world, at least for me. And so I was like, I got to keep going. Like I got to keep pitching and I got to keep like reaching out, which is very uncomfortable for me because you feel like you're begging. But like, you're just like, I'm not begging, like just trying to promote my services. I think it was just kind of, I don't want to say it's because like I didn't want to fail, like a drive not to fail. I want to say it was that. I think it was more of like, like I'm committed to this. Like this is how it goes. Like this is the part of freelancing, like, it flows. And I guess like in a way, I know this might kind of sound silly, but it was kind of like my kids are always watching me, and I always want to be like, you know what, things aren't going well right now, but like, this is how I just kept going. Like, you just have to keep persevering, and you just got to keep pushing, and you got to make yourself uncomfortable. And like, I think it's kind of like a lesson from them that I'm teaching them, that like, I'm getting very uncomfortable doing some of this, but I just kept going, and like, it's all going to work out in the end. And so I guess like part of that was them too, whether they know it or not, but just being like, look, I'm still doing it. It's uncomfortable, but like, this is what I'm doing. So
I love that your kids are a source of inspiration for you. It reminds me, like, it took me back to some nights when your kids would be like in the background listening in, or when you told me about how like sometimes you read out loud, like you'll read what you wrote out loud and see like, can they understand it, or use that to inform how you change things. So I love that they've been a part of this process and this journey with you. What were your most significant areas of growth when you completed the accelerator? Like, what did you feel most proud and accomplished about having done?
I think definitely the portfolio. At the first one, I just remember like when I got the edits back on the first one, I was like, okay. I mean, it was probably typical for a first, right up. But I was like, okay, this is it. And so I just like changed it, and then after that, you kind of just build on it. And I just felt as I did each one, I just got more comfortable and more confident about it. So I would definitely say the portfolio. I think also like the growth with like the business side. So like this is like finding clients on LinkedIn, how to leverage that platform more, doing the pitching, like all those things, and just becoming more confident in those. Because like still, like I mentioned, like in November and December, I was doing tons of pitching. So kind of like it all came through in January. It definitely wasn't the timeline I wanted. It was like, no, I want it now. But like, it's just like, just goes to show you just need to keep going. And it'll all fall into place, I believe.
Yeah, the seasonality that you talked about earlier, and then kind of our referencing here, is a very real thing in this space. And so it's like, all right, I just need just enough motivation to like get myself through this season, or like get myself through these 2 months, get myself through these 3 months, and things turn around, because the freelancing is a business, and business cycles, just like the economy cycles and everything else cycles. And so it's like, do you have what it takes to get through the rougher parts of those cycles? And I've enjoyed watching you go through that process and being able to support you through it. You stated in your bio that you transitioned from clinical pharmacy to medical writing and editing. So is that what you're doing full time? And what was that transition like for you? And how does it feel to be working for yourself in this capacity?
So I am doing it full time. I was on a career break when I started and ended the program. And I just kind of really fell in love with the freedom, I guess, in the sense that freelancing gives you, in the sense like schedule wise. And so that's really primarily how I make income, is through the freelance writing. So do I do it 40 hours a week now? Yes. I just took on a part-time or a short-term contract with a client that's full-time. But prior to that, that's really what I did as full-time work. Maybe not 40 hours a week, but sometimes it probably was close to 40 hours. But
yeah. And congratulations on that that full-time short-term contract, by the way. That is quite excited for you. Okay, we're winding down, but I have a couple of questions to close out. Have you found, and if so, how have you found community and networking and relationship building to be a role in your journey? Like, has that been important to you? And if so, how so?
I think it's huge. It's hard. It feels hard at first, like making connections on LinkedIn. But it's been really great. Like I've done a couple like coffee chats just to chat and like get to know someone. And it's been really nice because you're connecting, and then you kind of like grow your network just based off, like commenting on their profiles. And it's been really nice because we kind of all support each other. And one of my connections started doing like a monthly, what's it called? Like a monthly post where everyone can kind of like post their, like their latest article. And it's been really fun to like read some of what other people are writing, obviously not always in the healthcare field, but it's been really kind of cool and like supporting each other that way. And then they kind of do the same for you. So it's been like really nice to have that virtual connection, I guess.
Yeah, I'm glad that you have that. It can be lonely as a freelancer sometimes, so it's like really helpful to have those people who understand the journey without you having to like explain everything. Yeah, I'm right there with you, and especially in those moments where like things are harder, I have found it really helpful to have that kind of connection and community. So I'm glad that you've been able to build that for yourself also. Last two questions. If you think about your freelance health content writing and medical writing experience today, in what ways do you feel like you pull the most from things you learned or gained during your time in the accelerator? Like, what is it that you experienced in, I can't remember if your cohort was 4 or 6 months, but in those 4 or 6 months that you still find yourself pulling from and referencing today?
Definitely the pitching and the LinkedIn, like how to build a LinkedIn community, I guess.
Yeah.
So definitely those, and then definitely the portfolio pieces. Like this is how you start, like think about who's going to be reading this, like write for that person. Just kind of like those general building, like this, how you look for clients, like try and find, the top 10 articles, research, like I think the portfolio on the business sides were huge.
Great. Glad those are useful for you. And what advice do you have for a pharmacist or other type of healthcare professional who's considering making that transition into health content writing or medical writing? What would you have done anything differently? What would you tell them? What do you think they should know in the early stages of their transition?
Don't give up. Even when it seems like no one's ever going to hire you, just keep going. Definitely don't give up. Definitely do your pitching. Like Megan says, do your pitching. Definitely do it. It will all come back. And I think my other one would be make sure you have a really nice headshot that you're willing to give to everyone.
We love the practical tips.
Have your headshot and your bio ready, because once you start getting them, everyone's going to ask for it.
That is awesome. And then any advice for folks who are considering the Health Professionals to Health Writers Accelerator, who are thinking about it or on the fence? What would you tell them? I
would definitely say watch your YouTube channel. There's so much great information on there. And then part of me wants to say just do it, but I know like everyone has a different circumstance. It was probably one of the best things I've ever done. And it's really opened so many doors for me. So I highly recommend it.
Awesome. Well, thank you so much for your time, Emilie, for your insight and your expertise in sharing that with everyone who's listening in. We are rooting for you and your continued success, and we'll stay in touch.
Perfect.